Good morning, everybody, and welcome back to your Lunch Break Live. It is Wednesday. My name is Savannah if you are new here, and if you are not new here, thanks for coming back. Today, I thought it would be a good shift from yesterday's video where I took you out to the Hoover Med and showed you the first day of that mass vaccination site opening. I thought it'd be a good day to answer some of your most frequently asked questions about the coronavirus vaccine. And when I say that, I don't necessarily mean medically, but where you can get that vaccine, how you can get it, who do you need to call, what website do you need to go on, etc. So I brought in our resident vaccine reporter, Dennis Pillion. He is going to help us answer all of your questions. And if we don't have the answer, we're going to try to get it for you. So Dennis, thank you for coming on and being willing to go through some of this information. I know it can get a little bit crowded in your head when you see all these different websites and numbers and you don't know where to go.
There's a lot going on, but we'll do our best to get through and get the answers out.
Now, it seems like there are a lot of people who, while they might be upset about not being able to get vaccine, they're also equally or more so confused about how to do it. It's not that they don't want to or they want to argue about getting it. They're good and ready to go. They just don't know where to go. So let me ask you, while we still have some people getting on and joining, let me ask you, what is the best way to go about signing up to get a vaccine in the state of Alabama?
It'd be great if there was just one answer, right? But there's a lot of different options. It's going to depend on where the person lives. It's going to depend on who their medical provider is. The state, they set up this statewide web portal and a hotline for people to call in and try and get some of that information. But that's only statewide. I mean, that is statewide, but that's only booking appointments at through the county health departments and through kind of the sites that are kind of run by ADPH. It's completely separate from that. There are hospitals that have supplies of vaccine. There are clinics. There's even a handful of pharmacies that have it and are giving it out, and that's separate from the ADPH operation. So for a lot of people, their best bet is not going to be going to that ADPH website. It's going to be going to their local medical provider, their primary care physician if they have one, or just depending on where they live, maybe the major hospital in their area.
Is there any plan for, on the Alabama Department of Public Health side, to integrate these other locations, these local hospitals, these local pharmacies, and universities like UAB that we see giving out these vaccines? Is there any way that the ADPH is thinking to make one comprehensive place for all of that information? I understand they're not maybe necessarily affiliated in any way, but just making a one large one-stop shop for information.
That would be great. I'm not sure whether they're developing that or not, but that would be a super useful thing. I know similar to the ADPH website, the Jefferson County Health Department in Birmingham and the Jefferson County Emergency Management Association, they have a website that's closer to that. People can put in their information, answer a few questions, and then the EMA will notify them when they're, okay, now you're eligible. Here are a list of places where you can try to schedule an appointment to get the vaccine. It's not actually a scheduling portal. You're not going to directly make an appointment that way, but you can get a head start. You can say, okay, I'm going to know when I'm eligible, and I'm going to know what number to call when that happens. And I think that's maybe going to be the best solution for this going forward, just to kind of let people know 100%, yes, I'm eligible. I can get this now. Here's where and how I can go about doing that.
Now, I have a good question from Chris I'm going to get to in 2 seconds. But before that, you made that really important distinction where the Jefferson County and some of these county health departments, if you look on the website there, you are signing up to essentially get notified when you're eligible, and you're signing up to get more information. You are not signing up to get an appointment to get that shot. Now, with the ADPH website, though, you are trying to sign up to make an appointment. Is that right?
Yes. So every county health department in Alabama got a certain quantity of vaccine shipments. So they are actually making appointments and giving out vaccines at the county health departments. And so the scheduling portal that ADPH has launched is to schedule appointments at those county health departments.
Okay, so that's an important distinction to remember. Go to Jefferson County, you're getting more information. Go to the state website, that's where they're making appointments. Now, Chris asks, when will people under 75 be able to get the vaccine in Jefferson County? I've been to UAB, they said no because I'm not 75. So, Chris, here's your short answer. And I say that because there's also a long answer, as there always is. On February the 8th, that is next week, there's going to be a new eligibility opening for people that are 65 and older. So that's another gap of people that are in that 10-year gap right now where they're only doing 75. So they're going to go to 65 and older, plus a group of other essential workers, they're calling them. We've got grocery store workers in there and other job fields. We'll list all that for you here in the comments. You can go on AL.com to get all that, all those different groups. There's several. I don't know them off the top of my head. But if you are not in one of those groups, if you are just either what they're calling, I think, general population, which includes a lot of people and is a really broad term. But if you are in that term, we don't have a specific date on that yet. Now, I know that's frustrating because if you're like me, you have heard people that are not 75 and older and that are not healthcare workers, that are not first responders, that are getting vaccines by going to other places, either across the state, by going over state lines. And I think that that is what is so frustrating to people, Dennis, is I don't fit into the eligibility right now, but my second cousin that's 64 went to Valley, Alabama, and got a vaccine there. What can you tell those people, Dennis, that are like Chris and just trying to figure out when they are going to be eligible? And if they're not eligible in this county, where can they go?
Yeah, it is very frustrating. And I think another part of this is, on Monday, which is February 8th, we're opening up this whole other group, which is about 1 million people in Alabama that are suddenly going to be eligible for this vaccine who are not currently. But a lot of these places that are giving it out already are fully booked with their appointments, in some cases even through March. So you're having all of these people that suddenly can get in line on February 8th. That doesn't mean they're going to be getting their shot anytime soon, because there's already such a backlog. So, if, say, I'm 67 years old, I'm not, thankfully, but if I was and I try to get in line on Monday, it may be March, it may be weeks and weeks before I'm able to actually get that appointment to get my vaccine. So I think that sense of frustration is going to continue, and hopefully there are some bright spots. It's not all doom and gloom. The state is getting some of those supply chain issues worked out. We are getting more doses that are arriving in the state, and we are having more providers that are going to come online. As that happens, we're going to be able to get more doses out more quickly. But right now, we've got a pretty spectacular logjam going on in the state that is going to continue until we get enough doses on hand to start being able to offer it to everybody.
Something that this kind of goes along with the question from Deborah. She says she's 63 with chronic asthma. Something that I think a lot of people are frustrated about, and rightfully so, is that before we got these vaccine doses, before the vials were in our hands or in the state's hands, we had heard so much about these 1A, 1B, 1C categories that really neatly listed the people who would be eligible in each phase. Well, fast forward a couple of weeks to where we're actually administering these vaccines, and those categories are not quite as neat. And I know that we have been told by the Alabama Department of Public Health that there will not be a switch that will be flipped and say, okay, done with 1A, let's go to 1B. And I think that's really frustrating to people because there seemed to be such a neat category before, but now it seems like the floodgates have opened and those categories are kind of meshing together and mixing and mashing. So I say that because we've got people like Deborah that are just under that 65 category, but do have chronic health problems. Dennis, what do we know about those people?
Yeah, so we put out this Alabama vaccine allocation plan, which was patterned after the CDC recommendations and guidelines. It's really the CDC is the group that kind of divided everybody up and said, okay, these people are 1A, these people are 1B, these people are 1C. But kind of as we went on, there was a lot of pressure to get vaccines out more quickly. We had that terrible rush of cases over the holidays. We have the different variants coming in. So there's a lot of pressure to get as many people vaccinated as quickly as possible. And so then the CDC itself, after issuing these kind of really rigid tiers, they kind of modified that. And they said, well, maybe you should go ahead and open it up to everybody over 65. You should, maybe be more flexible on this tier to offer it to more people to just try and get it out more quickly. So, I think the states have kind of felt like there have been some changing guidelines. And I know even, there are different situations in different places. So like some counties, we saw the county health department really breaking from those tiers early on and offering the vaccine to teachers or to people who were 75 and up before that was happening statewide. And they kind of made that decision at the local county level. Well, we have these supplies, we've gotten a certain percentage of our healthcare workers, because that was the first round, right? Healthcare workers. And some counties felt like, well, we've vaccinated as many, it's going to take us more to get those last few straggling healthcare workers in, or maybe they don't want to come in. So we're going to go ahead and open this up to more groups. And I don't think anybody wants to tell people if you have vaccine, you shouldn't be giving it out, right? That's not the message they want to send.
So essentially, this is a decision that's kind of being made on the local level at a point.
It really is. It's there are guidelines, and there are kind of, the federal guidelines were made, and then the state kind of has their plan together. But some of the individual counties and clinics have been kind of going off script a little bit. But to kind of get back to your question, say people with certain conditions, that make them more likely to have a bad outcome if they have COVID. Right now, those are in phase 1C, which is kind of the next one after. On Monday, we'll be full on in 1B. That'll be everybody in 1B, I believe. So that's kind of they would be the next group up after that.
So, Deborah, it looks like you're going to be that next group. February the 8th, we've got about 1 million more Alabamians that will be eligible to get in line for those vaccines. So it looks like, Deborah, you are going to be in that next group. There's a lot of us that might either be in that next group or even 2, which is after that 1C phase. So taking it day by day, I think, on that side. Now, looking through some of these questions, and there was one that I thought was really interesting. And if I believe that we have something similar, and if we don't, I'm going to work on making you one, DK. But DK says, where is there a simple chart or a list of these categories and details on qualification per each? And where can I find that?
So the long answer with all of the details is the Alabama State Vaccination Plan, which is a PDF document. It's like 2 or 3 pages released by the Department of Public Health. I had a story recently, about extending this to that maybe we can link in the comments that has that kind of broken out in bullet points, and maybe we can draw up some kind of graphic there. But the Alabama Department of Public Health really has the best. I think it's a 2-3-pager, something like that has all of the tiers broken out, and then kind of some of the sourcing on, the CDC recommended these people in this tier, and here's a longer list of people that fall into this category.
So DK, it looks like the Alabama Department of Public Health state vaccination plan is the best place to look at that now. We also have that on AL.com. But if you're looking for something that has it more in a visual format, we'll see if we can work to get that created for you, because I think a lot of people would probably be interested in that as well. Now, going through some of these other questions here, and I will quickly answer one from Eleanor. She says, I had the mild virus in January. I'm 80 with health problems. Should I wait 90 days for any vaccine? Eleanor, I'm just going to kind of punt back to something that Dr. Sag said when I had him on here a couple weeks ago. And Dr. Sag, and I believe also they have had people from the Alabama Department of Public Health echo this, and that is, if you have had the virus, you need to wait about 90 days, 3 to 4 months before getting your vaccine. So that is what our medical experts have been saying. Again, I'm not a medical expert, but that is what we have been reporting that they have been saying. So we're glad that you only had a mild version of the virus. Glad that you are feeling better. Now, this is a good question from Alicia, and unfortunately, I don't know that we know the answer, but I think it's important to discuss. And Alicia says, why are there no drive-through locations in rural areas? After practicing social distancing for months, why are we now crowding into a building to get the vaccine? Alicia, I would love to know what location specifically you're talking about there. But Dennis, I think that is a question that a lot of people have been wondering. And on the flip side of that, if we only have drive-throughs, what about the people who don't have methods of transportation? How are they supposed to get it?
Sure, and that's going to be really important going forward now, as we start to have more places that offer the vaccine. The ADPH, first of all, for the drive-in clinics, ADPH has announced that starting next week, they are going to open up 8 drive-in clinics, kind of large-scale operations across the state. But those are going to be in the cities. I have the list of cities here. I think it's Huntsville, Birmingham, Anniston, Montgomery, Mobile. I'm going to leave some out, but they are kind of the larger cities scattered across the state. I know, State Health Officer Dr. Scott Harris, he's talked a lot about making sure that we don't leave communities out and making sure that we roll this vaccine out into all corners of the state, especially for populations where they may have transportation issues. It may be physically hard for them to get in and receive the vaccine. But another bit of good news on that front, more providers, as I said, are coming online and being able to give out the vaccine. The state has announced they're working with Walmart pharmacies, and so it could be in the not too distant future that a lot of these areas where they may not have a hospital, they may not have a major city, but if they have a Walmart pharmacy, they may be able to offer it that way. Still getting it out to people in rural areas, people who have transportation issues, is going to be a real challenge. It's hard to logistically come up with a solution for that. I know they're working on it. I know it's concerning to them, but at the same time, they're also trying to get as many of these doses out to the public as quickly as possible, just to try and get the rate of transmission down, right? Like, the vaccine doesn't do any good sitting on a shelf, but if you can get it delivered to a person, then that will reduce the spread generally in the whole community and benefit everyone. But those kinds of logistical issues and those equity issues, making sure that we're not leaving people behind, are going to be really important going forward. And I wish there was a better answer now. But I think the only answer we can give is that they are aware of the challenges that presents, and they're trying to figure out a way to deal with it.
We'll stay on top of that as well and make sure we get the most up-to-date information, because I think that's a topic a lot of us are concerned about. Dennis, I want to ask you something that I got a question on Twitter, and this is from Rufus. And he says, look, the ADPH website opened. That's great. But if you go onto that website and you try to make an appointment when you select your county, there are so many counties that either say, quote, no appointments available, or, quote, your county is not scheduling vaccines at this time. He says, why is that the case? Why are some counties just not participating in this? Or why are some counties not available to access through this website? And what's the point of having a website if most of the counties in the state are not going to be available?
So I haven't heard of any counties that are not participating. It's that the counties don't have any appointments available. And as with many providers, they are very reluctant to schedule out appointments beyond the number of doses that they have in their freezers right now. Because the vaccine, we have more providers in Alabama. We have many hundreds more providers that are signed up and ready to give the vaccine than we have doses of vaccine to give them. So, if you're running a clinic or a county health department or something, you don't want to schedule 100 people to come in and receive a vaccine, and then all of a sudden you don't have a vaccine to give them. That, is really going to be a problem. So to avoid that, a lot of places, they're only scheduling out as many doses as they have on hand, because they don't know, from week to week how many doses they're going to get. They don't know exactly what the supply is going to be 2 weeks from now, a month from now. And so that's kind of the answer there, is that most of the county health departments are booked up. They've booked up all of the doses they have on hand. Like Dr. Harris says, those doses already have a person's name on them. Someone is already scheduled to come in and receive that dose. Or they say, okay, we receive 500 doses a week or whatever it is. Our facility is only so big. We can only handle so many appointments per week. We're booked up through the end of March. So we're not going to schedule people beyond that.
Quick question. I had one I was going to, but I think this is important based on that answer you just gave. This is from Deidre. She says, I don't see American Family Care on the website, I guess, of available providers, but I have an appointment there to get vaccinated. Is it possible that the state left off a few locations when listing that?
I would say that is possible, yes. And I would say that if American Family Care is willing to book an appointment with you to receive the vaccine, then I would certainly hope that they have one to give you.
Yeah, and Deidre, please let us know what location that would be. I'd love to know. And if you don't feel comfortable leaving in these comments, you can DM us or DM either Dennis or I directly and let us know. Question that I have actually some people in my family who are wondering about, and this is from somebody, they sent it to me and said, if I registered for the vaccine a couple of weeks ago via the phone hotline, is that registration still good, even though the state has moved to online registration? In other words, am I still registered?
Yeah, I mean, absolutely. I would certainly hope so. The state, they opened up that phone line registration, and it just got immediately swamped by the volume. So they, opened up an online method to help kind of ease some of that log jam. But yes, if I believe early on in the process, that it depends when they called, that hotline was only taking information at the beginning. I don't believe, they were taking information and scheduling appointments. So if you have an appointment, then I would, assume and certainly hope that appointment would be kept. And then if you just left your information to be contacted later, I would certainly hope they're also still doing that. The website, we should say, there are two different options on there. One, this ADPH website. One is actually to schedule a vaccine, and one is kind of to sign up to be notified when you get eligible to get more information. So that might be a good option for somebody if, say you live in Birmingham or you live in Dothan or wherever you live, and you just want to get the first dose available, maybe you can sign up to get notified when you're eligible through ADPH. And you can also look, I know East Alabama Medical Center has an online sign up, UAB has an online sign up. A lot of these providers have their own signups or places where you can register and put your information down and say, maybe not necessarily get an appointment, but just at least say, notify me when I can come in and schedule this appointment.
So the important thing here is to know what you're signing up for. Know if you're signing up for an appointment, and equally know if you're signing up for only information. So be careful. Make sure you remember that distinction. And if you have already got an appointment or if you've already registered over the phone, then like you said, Dennis, let's hope that carries on over. There's no reason to believe that it would not carry over.
And if it doesn't, let us know. We'd love to know about that.
Nettie asked, when will patients with chronic illnesses begin to get the vaccine? Nettie, that is something we talked about a little bit earlier, but that was in the 1C group. I know it seems like we've maybe gotten away from some of these organized categories, but the short answer here is that you should be able to get that vaccine after this February 8th eligibility opens. February 8th eligibility is for people 65 and older, and then in other groups based on your profession, essentially, but and your essential worker status, et cetera. But Nettie, hopefully that next group that opens for eligibility will be those people that have pre-existing health conditions. The problem is, as we have said before, eligibility does not equal a vial with your name on it. And that kind of boils everything down to the root of the problem, right? Just because you're eligible to stand in line doesn't mean you necessarily get that vaccine. And Dennis, did you have anything to add to that one?
Yeah, just not right away. I mean, really, the state health officials, as they keep saying over and over again, the supply is the biggest issue. If they had more doses to give out, then they could ease a lot of this. But because it's such a limited supply, they're really running into problems.
Looking down at my questions here, and I've got one from Jerry, though, that just asked, and he says, we've been told to get the same second dose as the first dose from the same vendor. How do we know that as a recipient, we're getting the same second dose from the same manufacturer as the first? Jerry, I think the important thing to note here is that if you got Pfizer, you need to get Pfizer. If you got Moderna, you need to get Moderna. It doesn't necessarily matter from my understanding, the location where that was exactly bottled and made. It's just the brand. You need to be getting that same brand. Is that right, Dennis?
Yeah, and second doses have been really confusing for a lot of people. So the way that second doses work, if a clinic or a health department or whoever gives out, say, a first dose of the Moderna vaccine, they're automatically signed up to receive a shipment of the same number of doses 2 to 3 weeks later for second doses. So if you get your first dose at a provider, they should be receiving automatically a shipment 2 weeks later for your second dose. So you should be able to go back to the same place where you got your first dose. You'll have to make an appointment. You'll have to schedule with them. But that process is supposed to be more or less automatic, where you would go get your second dose in the same spot that you got your first dose. They're going to be receiving those shipments that are kind of earmarked for the second dose. Now, it's not that they are, when a shipment comes in, they're not holding half of that shipment to give as a second dose 4 weeks later. That's not how it's working. When a shipment comes into a pharmacy or a clinic, they give it all out as a first dose, but they are signed up to receive that second dose about a week before they're supposed to give it out, is what the state health officer, Scott Harris, told me.
So, Jerry, my suggestion would be there, if you start getting close to the date of that second vaccine that you're due and you haven't heard anything, I'd give that person a call, that provider a call, and see what the deal is there. I do know there are some providers that are already, once you get that first dose, as Dennis said, scheduling you out. I know one place that is even saying, look, you come back this day at the exact same time to get that second dose. So, Jerry, if you didn't get any information like that, ask your provider, but that's probably the case. Question from Carolyn. Why is it so difficult to sign up? I'm over 71. I live in Shelby County. So, Carolyn, you're technically, you are going to be eligible starting Monday, right? 65 to 75 will start being eligible. Why is it so difficult? That's the $1 million question. I think if either Dennis or I could put a fix on that, we would probably not be here right now. But I think that unfortunately we have seen here that persistence is key, and unfortunately having to really work at it is what it seems like is the way that you are going to be able to get that appointment. So, Dennis, any advice for Carolyn?
The best advice would be to check with your, if you have a primary care doctor, to check with them, to check with, for instance, UAB Hospital has an online portal for UAB patients. So if you're already a patient at UAB, you can sign up through their portal. And there's a separate one for kind of the general public, but they're offering it to their people who are already patients first. So I would check with your healthcare provider, if you already have a doctor, see if that doctor if they have access to the vaccine and they can give it to you. And otherwise, I would just kind of, at this point, be monitoring, because we've heard the state is getting more steady supplies coming in, more providers are coming online. They're going to be working with places like Walmart pharmacies to start offering the vaccine. So that might be a good route to take if you don't have a primary care physician provider, or if they are not offering the vaccine.
Carolyn, also, we make sure you check out the links here in this comment thread, because on our website, we have a story that has all the links out to different places where you can sign up through the State Department of Health. We have one for the Jefferson County Health Department. It sounds like you might be, though, in Shelby County. So check that out as well to get some different links where you can look. Kelsey asks, are people working in social services in phase 1B that opens on Monday, or 1C? Kelsey, I don't remember that off the top of my head, but we will comment back and let you know the list of people who are eligible in that kind of final group of 1B opening Monday, or if you're going to be in that next one. And then I'm going to end here with one comment from Carol. And I can't answer it, but I am going to say it. She says, another thing that makes me mad, why are people that got their shot want to tell everybody else to be patient, but they already have their shot? Carol, I can't answer that for you, but I feel your pain. And I think everybody that wants to get their shot probably feels that same sentiment. That is kind of the unfortunate way that this is working. And also that is also kind of similar to somebody saying, well, I got a new car, be patient until you can get yours. So Dennis, I think that we can definitely get Carol's comment. And also I think a lot of people, Carol, are feeling like you.
Yeah, and I will just say I have not gotten my shot yet. I'm really looking forward to getting it, and I understand the frustration, but I really do think that the steps are being made. They've got these ADPH has these 8 kind of large scale drive-in clinics that are going to be opening up next week. I think as more pharmacies and more places come online, there'll be more options. There'll be less of this kind of logjam confusion for how to get people in and get this taken care of. So I hope things are going to start getting better here as we go forward, but it's going to be a crunch for a while. So I'm someone who doesn't have my shot also telling you to be patient, and hopefully things will get better.
Carol, I don't have my shot either, and I'm not a very patient person, so I get it. I get your frustration. Dennis, thanks so much for coming on here, breaking down some of this information, and for answering questions that a lot of people have.
Anytime.
Thank you, Dennis. Everybody, thank you so much for watching. If we did not answer your question, we'll do our best to jump in the comments, answer them there, or to find out the answer as we can. So thank you so much for your questions, and thanks for tuning in. We'll see you tomorrow.